Next, we have Professor Meland from the School of Nursing. With a passion for patients with diabetes, she has worked with clinicians and patients as a diabetic specialist with Eli Lilly for 7 years, and she joined Yale in 2007, where she has served as the course coordinator and lecturer for the instruction of drug therapy for the graduate entry specialty in nursing program and clinical pharmacology for the master's program. Thank you very much.
Good evening. Ooh, it's a little loud. Sorry, I'm loud, as my students could tell you. So first, I would like to thank my students. This is an incredible honor, so I'm very, very happy to be here. So thank you, and also thank you to the Inspiring Yale team for organizing this great event. So, to begin, a little different. We're taking a little different turn. I'd like to share 3 things with you that completely seem random, but during the presentation, I will do my best to demonstrate how a unicorn, Yale School of Nursing, and Spider-Man actually tie together. I know it may seem like a stretch, but hopefully I've piqued your curiosity, and as I would tell my students, just be patient, hear me out, I'm really going somewhere with this. So you see, the unicorn refers to me because I am a little unique when it comes to Yale School of Nursing. I am the only pharmacist that teaches within the graduate entry pre-specialty and nursing program, also known as the GEPN program. I am surrounded by nurses, nurse practitioners, PhDs, just to name a few, but I'm the only PharmD. As a result, some might consider me a bit of a unicorn at YSN, hence the unicorn, but frankly, I consider myself to be incredibly lucky to be surrounded by these amazing people. When I took the oath of a pharmacist many years ago, I vowed to devote my life to helping others and to assure optimal therapy outcomes for patients. There is just something about the power of a chemical entity that has always fascinated me. And this is especially true when we realize that drugs are all around us, whether it's the caffeine in our morning cup of coffee or that common headache remedy in our bathroom cabinet. A drug is any substance that, when introduced into the body, elicits a physiological response. When we can focus the use of these compounds to treat and sometimes even cure disease, now that's where the magic really happens. Yale is no stranger to the power of these compounds. There are some early examples that I'd like to share with you this evening where Yale has played an historic role in pharmacotherapy. And it seems like 1942 was a big year, so I chose 1942. So these successes were right here in New Haven. First describes how Ann Miller, who was a nurse herself, developed a near-fatal streptococcal infection. Fortunately, she was a patient at New Haven Hospital, where she was administered a new antibiotic, making medical history as the first patient ever to be saved by the use of penicillin. And then 2 pharmacologists by the names of Louis Goodman and Alfred Gilman from Yale School of Medicine discovered that while studying nitrogen mustard, which, as you might recall, was the deadly gas used in World War I, they found that it could actually shrink tumors. So you see, this was the first step toward the realization that pharmacological agents could be used to treat cancer. Pretty amazing stuff. But as you know, this is just the beginning. With discoveries and ongoing research in areas of therapy for cancer, autoimmune disorders, cardiovascular disease, and many more, Yale continues to be a pioneer in this area. So you may be asking right about now, why nursing? Well, you see, up until about 2002, when Americans were asked how they would rate the honesty and ethical standards of people in different fields, pharmacists led the polls. I'm just going to lay that down. And we did for decades. But you can't get too comfortable where you're sitting because the tides changed and nurses became number 1. And they have held this position for 15 years despite our best efforts. They have held the #1 position. So as they say, if you can't beat them, then join them. So you see, nurses inherently embody the qualities that make them the most trusted professionals. And that is why working with nurses and with nursing students has been my extreme pleasure. This led me to Yale School of Nursing, where I teach Introduction to Drug Therapy to the Gepin students. And on the first day of class, the students are eager to dive in and learn everything there is to know about drug therapy. I can almost hear their inner chanting, "Must learn all the drugs." Their thirst for knowledge is impressive, and their enthusiasm is contagious. The energy in the classroom is palpable. But they quickly realize that it isn't about memorizing drugs in order to pass a test. It is about learning how and when to use the powerful tool that drug therapy can be. It isn't just about ACE inhibitors, antibiotics, beta agonists, and thousands of other drugs and drug classes. It is about Mr. Smith, who's experiencing vision loss due to his prolonged uncontrolled diabetes. Or Mrs. Jones, who presents to clinic with leg pain only to find out that she has a deep vein thrombosis. And then there's Fran, whose generalized anxiety disorder is overwhelming and affecting her quality of life. So much to learn, so many questions, like, should I even prescribe a medication, or is a non-pharmacologic therapy warranted in this case? If a drug is needed, which one do I choose? What dose do I choose? And how do I administer it? What about the drug interactions and side effects? You see, drugs have the power to heal, but they are not without their risks. As nursing students that will evolve into nurses that will be administering drugs, or nurse practitioners who will be prescribing medications, I feel it is my obligation to share my knowledge regarding the appropriate use and risks of drug therapy. And I know you guys have been waiting for this moment, and this is where Spider-Man comes into play. So have you ever noticed that somehow Hollywood always helps to capture the moment just right? And so on the first day of class, I share that famous quote during an exchange between Peter Parker and his Uncle Ben, where Uncle Ben turns to an overconfident Peter as he's coming into his own as Spider-Man and shares these words of wisdom: "With great power comes great responsibility." Being a healthcare professional yields the power to help individuals in need, but it comes with the obligation to do no harm. And to that patient, their nurse or nurse practitioner can seem to them at times to be their superhero. So in closing, what does a unicorn, the Yale School of Nursing, and Spider-Man have in common? Although the unicorn represents me as the only pharmacist in Yale School of Nursing's Gepin program, working with nurses and for nursing students who are, in my eyes, truly superheroes and inspire me every single day, I wanted to share with you tonight that you can be an inspiration to someone else if you embrace your inner unicorn, your uniqueness, your individuality, and always act honestly and ethically, because we all have the power to make a difference in someone else's life. Thank you.